Hello, in this video we're going to describe medicine part 3. So firstly we're going to look at medication. So there's been misinformation over penicillin. It's a UK military intelligence that are responsible for it, and many people have accepted it where it's in fact lies. So penicillin cannot be watered down over time. It does not affect the immune system and make it less effective. Alright, it's part of the tech tree. It was put there for a reason. So we've got ineffective drugs and chemical inhibitors. That's the other problem that is with medication. As well as that, you've got greedy people increasing the price and cost of medication that people are forced to purchase in order to survive, when in fact that stuff does nothing in a lot of cases. So chemical inhibitors, just remember that the Black Lab and the New Zealand SIS does research into chemical effect on the body, and they come up with all sorts of inhibitors that can do harm to the body and cause side effects deliberately. And such side effects include increased sickness, and they can also give you another medical problem for later on. So a person, in particular, the groups that they're targeting are cancer patients. So their medication needs to be looked at. Alright, so chemical inhibitors can cause a lot of harm to the body. Examples are shortness of breath, that's a chemical inhibitor. Risperidone produces that effect on people. Alright? So increased sickness, deliberate. Alright? So witches, Wiccans and Freemasons like to make people suffer. That is one way how they do it. So they deny you the penicillin, the antibiotics, then they give you something that makes you more sick. It takes you longer to get healed. Or you don't get healed at all, you wind up in hospital, and then you wind up a patient for the rest of your life. Right, so chemotherapy, radiation does not kill cancer at all. It produces more lesions and the person becomes more sick. Alright? So just make that clear. Radiation does not kill cancer. Okay? So this is not part of the tech tree, should not be there. It harms the patient. In some cases, they torture the patient. So it needs to be looked at in great attention to detail. And if people are torturing patients, it needs to be halted and arrests need to be made of doctors that are responsible for this. So it creates more cancer with exposure to radiation. Now, you've got 4 seconds and 4 inches with x-rays. That's it. You don't turn them on and leave them going all day and have a look at everything. If it's closer than 4 inches, cancer. It produces cancer lesions. If it's on for longer than 4 seconds, it produces cancer lesions. Anything that looks through something is an x-ray. Alright, exposure to radiation. So the airports, if they have airport scanners that can look through clothing, that's an x-ray. If it's going longer than 4 seconds, that's radiation that causes cancer. Australia, I'm looking at you. Alright? Don't deliberately harm your people with an x-ray that looks through clothing. Right, so now we've got a list of cancers and their causes. And the finger is pointed directly at doctors. So, breast mammogram, not part of the tech tree. There was no breast cancer prior to 1974. highly suspicious. Alright, so the mammogram, they press the x-ray close to the breast. You're inside 4 inches, that produces radiation. Alright, the second way in which breast cancer happens is through an injection with a radioactive isotope. The location where the syringe goes is where the cancer forms. Right, prostate exam. A radioactive isotope gel that produces prostate cancer. There was no prostate cancer prior to 1997. So you come up with this idea, you carry it out, you say there's a problem, there was never a problem, people get cancer. Cervical cancer did not exist prior to 1999. The cause is radioactive isotope during the smear test. That's the reason why patients complain after a smear test. Not part of the tech tree. So you've got people who make up these ideas. Let's have a look at this, let's have a look at that. Alright? And it causes the cancer in the first place. Put a stop to it. Those of you who are doing it, you're going to jail. Look forward to a later video on the future of medicine, where we heal everything. Alright? I'm the Archangel Daniel, and I'm from heaven. In addition to what's been said, we'll discuss the bone marrow transplant. This is not part of the tech tree and accomplishes nothing. It harms and tortures both patients, and both always die. Just be aware, if a box is fitted over a patient's head, then they're going to be harmed horrifically, and the box is used to muffle their screams. So, and such boxes can also be used for drown rape and hypnosis, so that the patient forgets what happened to them or has a different opinion. Is the box being used for abortions on women? That's another question. So that may be happening out there. I'm the Archangel Daniel, and I'm from heaven.